And good afternoon, everyone. Thanks for joining us for this, our first press briefing of the week. Today, Orange County Mayor Jerry O. Demings will discuss our goals for the week, our COVID-19 numbers. He will also discuss antigen testing in Orange County. The mayor will also give an update on CARES funding for individuals and families, and report on the work of our strike teams and provide additional information. From the Florida Department of Health here in Orange County, Dr. Raul Pino is here with important updates on quantitative data on COVID-19 that is trending here in Orange County. Last and certainly not least, Orange County Comptroller Phil Diamond is here with discussion on tourism development tax collection. We begin with Orange County Mayor Jerry Demings. Mayor?
Good afternoon to all of you. Welcome again for being here. We had a lot of activities going on for the last few days. I want to acknowledge that Mayor Buddy Dyer could not be here. It is my understanding that he was exposed to someone who had tested positive for COVID, but he himself is in self-quarantine as a result of that. But I am reminded that the virus is still within our community. This past weekend, I participated in a number of events centered around the 100-year anniversary of the Ocoee massacres. And at one of the events, it was announced by the daughter of State Representative Geraldine Thompson that she had contracted the virus itself. So it just reminds me that it is still alive and well here within this community. So each week when we start the week out, I try to go over the goals for the week. And the number one goal that we will continue to have for the foreseeable future is to stop the virus from spreading within our community. I'm going to talk about the numbers here within Orange County in just a few minutes, but the number one goal is to stop the spread of the virus. Number two, we look to continue offering crisis assistance to individuals and families. And number three, we look to continue offering crisis assistance to our small businesses here within the area. As for the total number of COVID-19 cases in Orange County, we will be going off numbers that we received from the weekend, but there are a reported 48,729 cases cumulative here within Orange County. So when you put that into perspective, it could be likely that this week we will surpass the 50,000 mark of individuals who over time have tested positive for the virus here within our community. Since we last reported to you last Friday, we have seen an additional 320 cases, including Saturday and Sunday's numbers. We now have 591 Orange County residents who have died as a result of the coronavirus. That is an increase of 15 reported deaths since our last briefing on Friday. I know that Dr. Pino will get more into the specifics associated with those individuals who have passed as a result of the virus. Our two-week positivity average is now 6.2%. Of course, that is slightly up from where it was when we began the week last week. Dr. Pino, again, will have more details. In terms of stopping the spread of the virus, I think it does begin with testing and embodying all of those CDC guidelines that we have put into effect here within our county. So at Barnett Park, today we began offering additional testing there at the park. Rapid testing is available now for the first time at our local sponsored testing sites. We are going to continue offering the rapid testing, the rapid antigen testing, in addition to the molecular PCR test at the Barnett site. It seems to be very popular. Individuals want to get those results back as quickly as possible. Today, as of about 3 p.m., we had 549 people who were tested at the Barnett site. 503 of them took the rapid antigen test and 128 took the PCR test. Some of the residents actually took both tests because of their desire to be tested or symptoms that they were showing. The site at Barnett is scheduled to accommodate up to 4,000 different residents to be tested each week. We are able to do this as a result of some of the CARES Act funding that we have received. We encourage any of our residents who want to be tested to go to that site. It serves as a testing site for the entire county. We highly recommend that residents who want to know about the difference between the rapid and the PCR test, we have information on our website posted at ocfl.net/testing, and they can determine which test is best for them. Appointments are recommended, but drive-ups are also allowed. Our Cares for Individual and Families program continues to help our residents in need. We will be reopening the portal for more applications 1 week from today. That would be November the 16th, 1 week from today. So far, the program has helped more than 30,000 individuals who were negatively impacted financially by the COVID-19 pandemic. Eligible residents received $1,000 to help with expenses. The last 2 times that we opened the portal, October the 24th and November the 4th, the portal was able to stay open for at least 8 hours before reaching capacity. In previous application openings, the online portal closed in less than 1 hour. In order to serve more residents, I'm going to make a new announcement today. We're going to expand the eligibility criteria. The CARES team now believes that individuals who live in one household may be able to get multiple individuals in that household approved for the $1,000. So previously, if we went purely by the address for that household, if anyone in the household had received funding, then anyone else who applied was disqualified. What we're going to do now is open that up. So if there's another resident of that household who has been impacted by the COVID-19 pandemic, they can apply, and so now multiple individuals in the same household will be able to become eligible for these funds. Again, the next portal opening will be on Monday, November the 16th at 8 a.m. We plan to open it to as many as 15,000 different users. Again, you can go to ocfl.net/orangecares for updated eligibility details. And I want to give you an update on our strike teams to, again, try to contain the virus within our community. We are trying to make certain that businesses comply with the CDC guidelines. And so our strike teams now have visited over 4,600 county businesses, assisting them with workplace guidance and procedures. First-time compliance rates hover around the 87 to 90%. We have now re-inspected 558 businesses with a compliance rate of 81%. With voting now complete in Orange County, it is important that campaign signs be recycled. So we urge all of those political candidates who really peppered our county with signs everywhere. Get out and pick up your signs, but we would love to be able to recycle those signs. So I'm going to tell you about a partnership between Orange County, the City of Orlando, the City of Winter Park, the League of Women Voters, and Eco Strategies of Orlando. They have designated 5 different sites around the county, and I'll go over those sites in just a few moments. They are partnering with New, that's NU, New Cycle Energy in Plant City, which will be recycling signs into fuel cubes. They will use these fuel cubes to provide them to a large cement manufacturing plant to generate energy. So the 5 sites where you can turn in those signs, political candidates and those who support them, is at the Caddy Trail location, the Meade Botanical Garden, Winter Park Fire Rescue Station 64, the First Unitarian Church of Orlando, and Broadway United Methodist Church. This recycling initiative will run through Sunday, November the 22nd. For information about the sites that I just went over, you can visit the Orange County League of Women Voters website at lwv.org. LWV as in Victor, OC.org. And with that, I'm going to turn it over to Dr. Pino at this time.
Thank you, Mayor. Thank you, everyone, for being here. Before we give the data to auxiliary information, first, we understand the group of parents from Bridgewater Middle School were a little bit upset today in the morning, as on Saturday we neglected to forward an email with all the information to the principal of that school with the people who were supposed to be quarantined this morning. And our system works because immediately this morning we have a second layer. So everyone that gets notified by the school system also gets a call from us next day in the morning, checking how the child is, but also offering testing if they want to at our location in Lake on the Hill. So this morning when we were doing that second check, we detected that approximately 20 students that were supposed to be on quarantine did show up for the school because the name of the principal, the email was not included in the distribution email that goes on there. We immediately spring into action, and the students were segregated from the school and everything got into order, but I just want to offer you that information. Our apologies to the parents that in the middle, starting the work, the day has to get this new and pick up the children. But the system worked, so we were able to detect this. And we will do our best for this not to happen again. Our apologies, but just understand that there are thousands of cases that we are handling, and this is just a misstep, and we hope it doesn't happen again. On another note, we conducted a flu shot event, pod distribution event, last Saturday at Jones High School. We vaccinated 697 individuals, and it was a beautiful day. It was perfect for what we did that day. With that, we also are going to have our last event for now on November 14th. Next Saturday is going to be at the Colonial Promenade Mall on 4308 East Colonial. It starts at 9 o'clock. We have sufficient vaccines for over 1,000 individuals, but if it's as busy as we expect it to be because of the location, it will go very fast. So we advise individuals show up early and don't wait until the last minute, because at some point we run out of vaccines. We may have to cut the line. So the earlier you show, the more likely you are to get vaccinated, although we have sufficient vaccines, over 1,200, to provide on that Saturday. It will be free, no insurance information collected. You don't have to get out of the car. You just roll up, shoot up, down, go. And some individuals who may have special needs, we also can accommodate you to a walk-in setting if you have to, and we do take walk-ins. With regard to the data, as the mayor mentioned, the pandemic continues to ravage through the country, but also in Orange County. Our numbers are increasing a little bit, and I'm going to explain a little bit of that. Our total number of cases is 48,729 today, and our recovery rate continued to be at 94%. The median age is 36 years old. Our age range is from 0 to 110, and we have 591 deaths is our total right now. As the mayor mentioned, 19 deaths has been added since we talked to you last. Those were 54 to 100 years old range, 8 female, 7 male, 5 black, 10 white, 1 Hispanic, 14 non-Hispanic. 13 have underlying conditions, 2 didn't have that we know. And with regard to the infections, last week was the first week in the prior 5 weeks, we have a positive growth, meaning we have more cases than the week before. Last week was the first week. Remember, our week ends on Saturdays, and this is week 46, started yesterday. Last week was the first week that we have a negative growth of 10. That could change. We have a negative growth of 10%. That could change a little bit as the week goes by and we clean the data. But the prior week, that is week 44, we have 1,599 cases. Last week, we have 1,441. But I don't want people to be misled by the fact that we have a negative growth in 1 week. Our data shows that our cases are increasing and our positivity rate is increasing. Last week, the 14 days average positivity rate right now is 6.29, and 14 days ago was 5.39. So there has been a growth over this period of time. We would like people to continue to adhere to mask, hand washing, and washing your distance. If you wanted to know where the pandemic is in our county, again, it's younger adults in college age and their parents, younger parents, and people who know each other. What we are analyzing through the data, it is that people who acquire the disease most likely are acquiring the disease from someone that they know and that they were in contact with. So even though we have a community-wide distribution of the disease, and it could be a lot of touching and transmission in other modes, our transmission is occurring between people that know each other, they are in a social environment, normally indoors or outdoors, but very close contact. So, and that's why we have insisting in celebrations, family gatherings, and I hate to say birthdays, but birthdays too. So we have to keep our social gatherings to the smallest number possible, observing CDC guidelines. And again, you have to assume that everyone has the disease if you want to prevent it from getting it. With that, I will answer any questions that you have after, and I pass the microphone to Controller Diamond.
Thank you, Dr. Pino. Well, I am here. Good afternoon. I'm here to provide you with the results from September's tourist development tax collections, and this will include not just September, but it will also include the entire year, since September 30th is the end of our fiscal year. Tax collections for September were $7,037,700. That is roughly a 60% decrease from last year. As far as the entire fiscal year, since September marks the end of our fiscal year, we collected $167,386,000. That compares to about $284 million the year before. So that's a decrease year over year of about 41%, and in dollar terms, roughly $116 million. And to put that in context, that is the biggest year-over-year decrease in the history of the tourist development tax. Percentage-wise, it's the biggest year-over-year decrease in the tourist development tax, and that's an amount that we haven't seen since 2010 during the Great Recession. So that's where we are historically. Looking forward to this year's collections, there are definite signs of hope, and even though we are still below pre-pandemic levels, we've increased every month since April. Travel has been increasing as travelers become more comfortable with safety protocols and our region's relatively low COVID-19 rates. And an important factor, we think, is that there have not been any widespread reported infections stemming from any of the theme parks or the tourism areas or anywhere that should give anybody any concern. Finally, the vaccine news from today is very encouraging and very welcome. However, even though we've seen a steady improvement in collections over the past few months, there are obviously still major challenges. Our unemployment rate continues to be one of the highest in the state of Florida. And we do see signs in not just in Orange County, but in the northern states and other countries of continuing coronavirus challenges. And I think if travelers are concerned about COVID, then that could very well stop the recoveries that we've seen if they don't want to come here because of concerns about their safety. So from the standpoint not just of community health, but of helping to get our economy to get better, I would encourage everybody to continue wearing masks, practicing social distancing, all the things that have been said for the past 7, 8 months, whatever it's been. But that's what's going to keep us healthy, and that's what's going to help keep people comfortable about coming here. On the expenditure side, I think, as you all know, the county's been using tourist development tax reserves to fund ongoing obligations and offset shortfalls. And the county has used almost $63 million in reserves since April. In September, reserves decreased by $5.8 million, which is less than you are used to hearing, and that is due to the decisions to suspend or cancel convention center construction and design contracts and defer and eliminate other expenses. And those, combined with the increases that we've seen in tourist development tax collections, mean that we will be using reserves at a more sustainable level. And while we prefer not to see any reserves being used, it is a more sustainable level and in the long term financially more healthy. Finally, we'll have our numbers for October, the first month of the new year. We'll have those in early December. And I am happy to take any questions you may have during the question and answer period. Thank you.
Okay, let me thank the comptroller for that update. I do see it as encouraging. The worst post-pandemic, I think one month we saw somewhere around $700,000 that came in for TDT revenue. So the fact that the latest full month that we have numbers for being September at $7 million, I see that as encouraging. That perhaps there's a couple of million over the prior months. So we are moving in the right direction in that regard. And these are extraordinary times. You know, the comptroller talked about the historic perspective, 41% decline in year-to-date revenues. Since we've been collecting TDT revenues, we never had to go through a pandemic either. So this is what has impacted not just Orange County, but really all of America and all of the world, where we've seen the financial fallout related to the pandemic. So we have to make some adjustments. We have made some adjustments, which is what he has said to you today. We have made some decisions to reassign staff from the convention center. We have told construction projects and other things so that we can better manage the funds that we do have, and we will continue to do that in the foreseeable future. So we're joined today by two of our Orange County commissioners, Commissioner Uribe and Commissioner Gomez-Cordero. They're both fluent in Spanish. If there are any questions from the Spanish-speaking media, I also have Ms. Ilia Torres, who is here, who can assist with the translation. We also have in the audience today Mr. Scott Howard from the Orange County Public Schools, if there are any questions that are related to the schools. We also have Mr. Mark Tester, the Executive Director at the Orange County Convention Center, who is here, who is very prepared to answer any questions that you may have of him. And we also have Ms. Diane Arnold, who helps to administer our crisis assistance for our individuals and families. And so you have a number of individuals who can respond very specific to any questions that you may have. So with that, I'm going to open it up for any questions at this time. And so we don't have Ms. Lauren Seabrook here today. Otherwise, she would have had a question for Dr. Pino from the very beginning. So we're in the back today. All right.
Yes, but I do have a question for Dr. Pino. This is
Yes.
Nikki Zizaza with News 6. Dr. Pino, the first thing you mentioned was about the misstep that happened. Can you tell us how long the students were in school, those that were exposed in school, before your department was able to get a hold of all of them? And the second aspect of that is there any chance or are there any measures in terms of the other students or maybe staff who may have been exposed during that time that they were in school?
So I don't know all the details about the second part of your question, as we are going to start interviewing individuals and who they were in touch with and so forth. So, and with regard to how long they were, it depends when the parents pick it up. So it's going to be different for each. But we can provide you more information on that specifically. I don't have it. But I can tell you this thing about quarantine. We also have analyzed all the students that we have sent into quarantine. All that data was recently analyzed last week. And we have seen that our conversion rate is very low. The number of people that convert from negative to positive while they're in quarantine is very, very low. So we are going to be taking a look at the data also, not just this case, but other data before, to say if there is room for, after consultation, of course, with the state and others, to see if there is room to be more permissive. As the number of people who are really converting is not that high, we think that we have some room for improvement.
Emily Braun, News 13. Another question for Dr. Pino. So you were mentioning that a big group of transmission is, students and their parents. So thinking ahead to a couple weeks from now when we have Thanksgiving, that's a big opportunity for spread, obviously. So what tips or what advice could you give to those families who are concerned about, their students coming home possibly being exposed? Are there ways that you would advise to keep those gatherings a little bit safer than usual?
So listen, with Thanksgiving, you don't want to be the Grinch, but I will advise, if you don't need to have it, don't have it. And it's not because of the family congregation, because it's also a place where we honor and share with the elderly of our families. And sometimes they are the main host of those parties based on family traditions. And we are concerned for people who are over 65 and have pre-existing conditions. Because the younger population tends to be asymptomatic, about 25%. In some cases in the country, as high as 40% are asymptomatic, and they perform very well. But those who pre-existing conditions, that's not the case. And we are at a point where our mortality rate has decreased tremendously. Although we see those numbers and people we were in the 30 and 40s individuals dying every week. So at this level is under control. And although we feel the pressure in the data, I think if we continue to adhere to CDC guidelines, we can continue to work. But also I have alerted before that these numbers are getting to a point where it's very difficult to complete track investigation on each of those cases on time to prevent the spreading of the disease. So we also have an interest on keeping the number low so that we can perform better.
Danielle Lama with Fox 35. I have a question for Mr. Diamond. Are you expecting any sort of boost during the holidays? And when do you expect us to get back to where we were pre-COVID?
Good questions. The holidays are usually a very good time. Usually that's when students are off from school, whether it's high school, elementary school, college, whatever. There's usually a lot of travel, and it's usually a very good time. As far as this year, I don't know. You've got some COVID spikes up north. You've got everything's different this year. So I think December. The holidays are usually a pretty good time for us, so hopefully we'll see that again. As far as when we get back to normal, I was very encouraged this morning to hear the news from Pfizer about the vaccine. But then you see, well, it's 25 million people maybe that could get it this year. So I think it's hard to say until we see how that goes and see how COVID goes. But I guess, for now, I think the biggest things are, let's keep on wearing these masks. And that's the best thing we can do, social distancing, trying to keep everybody healthy. I think that's the best thing we can do as far as seeing things get back as good as possible and seeing people get back to work.
Kelsey Thord with West 2 News. Mayor Demmings, were you going to say something?
The question about when do we see improvement? I believe that this winter season we'll see some improvement in our numbers. Of course, the tourist development tax revenues are derived from when people stay in our hotels. And we know every year the number of people who stay in our hotels, hotel occupancy goes up during the holiday period of time. So there's no reason not to believe, even though it may be depressed from what it has been historically, we're going to see a bump because of weather and other reasons. Those number of hotel occupancies will increase here. But, I'm encouraged also by the announcement by Pfizer that the clinical trials indicate that they have a vaccine that will be able to produce a vaccine that's 90% effective. But even saying that, be first quarter of next year, 2021, before it's widely available. So I believe that in terms of when we will see any significant improvement, it's going to be probably late first quarter into the second quarter of 2021. And no one really wants to hear that, but our numbers will not return to anywhere near the average numbers that we have seen for quite some time. It may be several years. Okay, questions over here.
Kelsey Thord with West 2 News. This question's for Dr. Pino. You talked about how a majority of the cases are they're getting it from people that they know. What percentage would you say that is of the cases?
Oh, I don't have it in my mind, but I can bring that data and show it next Thursday if we have the conference Thursday or Friday. But it's quite interesting. And also on that, I neglected to mention that I want to give a shout out to EPCO and their employees and the work that they have done to, open the park and prevent the spread of disease and follow CDC guidelines. I visited EPCO last week with the medical director for Disney. It was a friendly visit. It was not an inspection. But I have the opportunity to see everything that they have done across this park and other parks because it's the same approach. And based on what they proposed to the economic recovery task force that the mayor put together. And it's just, they are doing a fantastic job. I was able to see the public coming in, following directions, hand washing stations, social distancing, some plexiglass on some areas, but also how they are ordering food and they are using apps for that. So with that, my shout out to EPCO.
Michelle Félix de Telemundo para el doctor Pino, nuevamente, disculpe. Doctor, cuando en el momento que usted dijo que hubo un leve incremento de los casos de COVID-19 aquí en nuestra área, ¿tendría esto que ver con los momentos que se vivieron en estos días de campaña? ¿Cuál es el temor de ustedes, en realidad, las autoridades, de que esto haga un aumento drástico?
The question was in Spanish if I attribute any of the changes in the number of cases to any of the political activities and campaign events that had happened in the prior weeks. Mira, la respuesta es que con seguridad algún caso ha sido transmitido en esos eventos. Tenemos la enfermedad en todos los lugares, pero nosotros no hemos podido determinar que haya habido un outbreak en ninguno de estos tipos de eventos. No lo hemos encontrado y no es porque no lo hemos buscado. Estamos buscando la data. Pero muchas veces dependemos de la información que nos dan las personas. Y entonces puede ser que alguien nos esté ocultando algo, eso es posible, pero todo el mundo nos está ocultando todo. No, eso no es lo que está pasando. Entonces yo creo que no ha habido ningún outbreaks related to those numbers. En la última semana los números disminuyeron un 10%, pero en las semanas anteriores los números siempre estuvieron por encima de 1.500 a la semana, lo cual es elevadito porque es más de 300 casos al día. Cuando tenemos más de 300 casos al día, las cosas se nos complican. Yes, and that was a lot, so I'm going to. So the answer is really we haven't been able to link any cases to any of the political rallies that had happened around Orange County or in Orange County. Although I will not say there was no transmission in those places because I can't. I can either say there was outbreaks because we have not detected those. And it's not because of we have been looking. We have been looking. Now, we also depend on the information that people provide to us. And sure, someone may not disclose everything, but not everyone is not disclosing. So with that, we have not been able to detect any outbreaks linked to the parks or to political activities in general.
Steve Hudak from the Orlando Sentinel. This is for Phil Diamond and for the mayor. So we have another quarter yet of this year, and we're not expecting vaccines to be widely available until maybe next year. So what suggestions would you have for how we should try to rein in our spending of TDT money, since at this point we're still way, way, way below what we were at that point last year, and it's a critical source of income. So I'm interested in your view.
Well, I think first, I would look at where we've come. I remember it wasn't that many months ago that we were talking about using over $20 million a month from reserves. And this month, we're talking about using $6 million a month from reserves. And I was very concerned when we were using $21 million a month, because that's just not sustainable. And when you look at what we have available at $21 million a month, you could burn through that pretty quickly. At $6 million a month, that's a lot more sustainable. Obviously, it can't go on forever, but it's certainly a lot better. And you've seen decisions led by the mayor as far as the convention center expansion and convention center construction, and that was a huge part of the $21 million and the and everything in between, and that's been huge as far as turning the battleship around, like that old expression. It just takes a while to turn around. Other changes, and the mayor, Mark Tester, can go into more detail, as the convention center's made some changes in their operations. They've repurposed what some people are doing so that people can go that may have been at the convention center. They can be doing other things that make more sense right now, given where we are. So I think those are some things that are going to make a difference. And obviously, as collections continue to go up, if we keep the expenditures where they are, hopefully we can wipe out that monthly deficit.
I would concur with what the controller has said, but we certainly expect that going into October, November, December, and forward, you're going to continue to see a reduction in the total expenses coming from the reserves. And I say that because for two reasons. One, our revenues are going to increase, I believe, within the next few months. Number two, we have reassigned personnel. We have taken a look at some of the construction projects, and other than the expansion of the convention center itself, we'll look at all the other rehab projects to see if there's an opportunity to defer them into the future. And then lastly, I think that we have an opportunity to also take a look at other expenses associated with the convention center and see if we can make some changes going forward. We are going to see likely additional shows that were canceled, that have been rescheduled. Some of them are going to go forward into the new fiscal year, into the new calendar year as well. So I think that that is going to have somewhat a positive impact, I think, on our bottom line as well. And so those things that we can control, we are certainly doing that. In terms of the debt service that the controller alluded to, and with some of those payments, we had payments due to, for example, the City of Orlando related to Camping World Stadium and some of the other projects that are going forward. We will likely defer some of those payments without adversely impacting those where we have to make to bond companies, et cetera. So we're going to use every tool within our toolbox to try to curtail the expenditures at the convention center and control the bottom line there. And so that's what we have been doing for these last several months, which is why you have heard the reports today. So we're going to continue, the short answer here is we're going to continue doing what we have been doing at this point to bring those numbers down. And because we couldn't, associated with the expansion project and the design phase and some other things that happened, shutting that spigot off was, there was still a slow drip from that. But after October, that spigot is essentially going to be shut off. And we won't have a steady drip of additional expenditures associated with that. And so, Mark, are there any other things that you would jump in there and say real quickly here? He's the executive director at the convention center. So we bring him in to answer these hard questions, if they're hard questions at all, Steve. We task him with thinking outside the box to do some of these things.
Yeah, thank you, Mayor. We have actually 118 of our employees that are working in other areas, both CARES Act funding and the Utilities Department, and we appreciate that support in helping us reduce our operating. The spigot, as the mayor described, is regarding the expansion project. We reconciled all those bills, and very little money is left on that, and then it will be unfortunately over at that point. As related to our capital projects that we have that are not related to the expansion, we've had a couple of big projects under activity that we actually started prior to the COVID outbreak, and we're over 75% completion. One of the things that has occurred during that time is having a little bit of activity has allowed us to be more efficient in getting those projects completed without having to start and stop them due to the number of events. So we'll be ready to go. We do have events that are scheduled in December and January and February. However, we have seen some events either cancel or reschedule later in the year. For example, the veterinary medical show VMX announced publicly today due to this is scheduled for January, is going to be moved to June, and they feel very confident that they'll have a much bigger event in June due to both the vaccine, but also corporate travel restrictions ending after the first quarter. So we really look to see a big uptick March, April, May, June, hopefully. But we do have events December, January, February, and some significant size events. Thank you.
All right, Steve, did I answer your question? All right, we can get you some details afterwards if you like. All right, other questions?
So this next one was texted from Eric Mock from News 13, and this one is for Scott Howitt with OCPS. His question reads, how does the district respond to teachers feeling forced to leave because of health risks related to COVID-19? He clarifies, because many teachers who have had health concerns had to leave when more students returned to the classroom, and because they all might have to go back next year.
So while students are our first priority, when we are looking to staff schools and making sure we have the resources, we need to make sure that we're serving them. Certainly, we have worked with teachers and will continue to work with teachers and staff that have concerns about their health, the impacts that more students would have on that, and we're taking those into consideration. As we brought back 15,000 additional students to face-to-face, we worked through that process. There are avenues that teachers can pursue. They can certainly ask for accommodations, and we work through that process to make sure that they have medical accommodations if they need it. We'll work through even up to and providing a leave, a long-term leave if they need to, in order to make sure and ensure their health. So we're working with our teachers, we're working with our staff. But the bottom line is, if students are coming back, we need to have those individuals in place to serve our top priority, which is our students, and make sure that they're safe and the proper protocols are in place to take care of them. We are still waiting for the governor and the commissioner to decide what will happen in January, the second semester. Once that happens, we will start making plans. We certainly will advocate for allowing us to continue with Launch Ed at home, because we know that parents are choosing that and want to continue Launch Ed at home. We know that there are teachers that want to continue to teach from home and do Launch Ed at home as well. But it will be driven by parent choice, and ultimately it'll be decided by the commissioner and the governor based on the learning models that we can use moving forward. So thank you.
Thank you. And then Mr. Howard as well, are you able to say how long the 20 students who were supposed to be quarantined were in school today? And if any additional student teachers now have to be quarantined because of it?
I know that Dr. Pino and his staff were working through that. I think the students were they were in school today, but they got them out relatively quickly once they were informed. Yeah, 26 students. So once they were informed that they needed to be quarantined, so it was just a matter of that. But I think they took care of that this morning.
And this one is from Lauren Seabrook from WFTV for you, Dr. Pino. She's here virtually.
Said it. She listened to. She hears everything. She said.
Dr. Pino, are you concerned to see more than 6,800 cases statewide on a Sunday when the numbers are usually, or at least the cases are usually the lowest? And why do you feel Orange County isn't going up as much as the rest of the state?
The first question, is going up around the state. And what we have, why we said the data is under pressure is because no matter how many tests we do total, even when we do 3,000, but when we do 6,000, we are getting about the same positivity rate. And it goes a little bit lower when we do more, but that's an indication that it's brewing and has been contained. And then that answers the second part of her question, which is why Orange is doing a little bit better than the state at large. Well, it has been an amazing experience to be here during this pandemic. The community, for the most part, has responded very well. The leadership of our mayors, both of them, has been of high value. And the fact that we have been able to work with the schools so closely. So this relationship between the state and the local government, as well as the population at large, is the coalition that we need to fight a pandemic like this. And not to put it last, because it's not least, is the role that the media has played carrying out these messages all the time and providing people with information that they need.
Thank you. And this last question is for Phil Diamond. This comes from Ryan Lynch with the Orlando Business Journal. Phil, what kind of outlook do you have for the rest of the calendar year for collections? Do you expect the increase since April to continue increasing?
Well, we talked about December, and people like to travel in December. The weather, the weather here is really nice, and the weather in the north and the Midwest is pretty miserable, right? So hopefully that'll bring a lot of people down here. Obviously, we want the coronavirus numbers to be low here and low up there. But I think, December is usually a pretty good month. So hopefully that'll bring us good numbers in December. And as far as the rest of the year, I think time will tell. The vaccine can only be good news as far as what we're hearing. We just don't know how long it's going to take and how fast people will be able to be vaccinated. But if people feel comfortable and safe traveling, especially if they're vaccinated, that's just good news for us.
I suspect that we're going to be wearing masks for a while, to help contain it. We're going to be socially distancing for a while, all those things that we've been doing. So people hopefully will not get fatigued, and they will continue for their own health's sake to do what we've been asking them to do. If there are no other questions, then this will conclude this press event. I believe we'll schedule for the next media update on this coming Thursday and not Friday. It will be Thursday and not Friday. All right. Thank you all. Thank you to the Controller Diamond and to Dr. Pino and the others who joined us here today.